Yesterday we had a few questions from one of our followers. I sent it to you. No one answered anything. And I think we should answer our listeners.
I prepared some things for answering.
Okay, good job.
Whether that is good or not.
Wait, let's see. So where are the questions? First of all,
Seems to be
it's pretty basic questions. And by the way, I talked with the person who sent it. She is a medical student. So it is very impressive that at medical school she is asking some important questions like that. And I think we should be able to answer it for all and for ourselves. First of all, Lavana, what's the difference between CVA and hemorrhage in the diagnosis of plain CT and why?
In hemorrhage, we have first we do plain CT to see if it is hemorrhagic or it is ischemic.
Okay,
So at the first, if it's hemorrhagic, so it's hemorrhagic stroke.
okay,
Otherwise, if it is ischemic, this is another.
see. CVA is a clinical diagnosis. It's not a radiological diagnosis.
Yes.
There are two types of CVA, either ischemic or hemorrhagic. The idea is the treatment is totally different between the two. If it is hemorrhagic, they will not give thrombolytic. If it is ischemic, they will give thrombolytic. If it is hemorrhagic and we give a thrombolytic, we kill the patient. Okay? So, when the patient is clinically diagnosed as CVA, we have to differentiate. We go make a CT scan. If we see hemorrhage, then it's hemorrhagic. If we don't see anything, then it's ischemic. Yani ischemic in the early stage will appear normal. Okay, later there will be edema and mass effect and thing, but not bleeding. Okay, first of all. زين منو يلا media. Let's go to the other one. What are the kind of diseases that require contrast media at CT examination? Why do we give contrast in CT scan?
In general,
In general, she's asking why.
to look for vascularity.
Just.
To differentiate between benign and malignant.
Can you differentiate between benign and malignant based on contrast?
No, يعني if
in general.
يا محلى الحياة لو ترى.
in general,
Okay. So
there is a mass.
I think in my opinion there are multiple uses for the IV contrast medium. First of all, to detect vascularity, to see if a lesion is vascular or hypovascular or avascular. If it is enhancing, it's a vascular lesion. If it is not, it is not. Because, for example, inflammation makes increased vascularity. Tumor, some of them are vascular. Some of them, not all of them, okay, are vascular. High first. Second,
Pattern of enhancement.
the pattern of enhancement can help us to characterize the lesion. Some lesions enhancing the arterial phase, indicating they are probably malignant. Some lesions enhancing the delayed phase or portovenous phase might indicate they are benign. Some lesions show peripheral centripetal enhancement, might indicate, like, for example, a hemangioma. So it differs according to the pattern of enhancement. Third, to separate the lesion from the normal structures. Like you have a lung mass, for example, and you want to see the relation to the pulmonary artery. You give contrast, you see the pulmonary artery and its relation to the mass. Is it invaded, encased, compressed, obstructed, whatever. صح? Fourth, to see the function of the kidney. You have a small kidney, you give contrast, you see if is it excreting, is it working or not.
Even if not excreting, you cannot say this is not functioning kidney.
The ideal test is by nuclear scintigraphy. But if you don't have it available, it's a way to help us, okay? Or to guide the surgeon.
Excreting contrast means functioning. If not excreting contrast,
Maybe,
you
yes,
cannot say
maybe.
this is not
But
functioning kidney.
but again, it will be at least marked decrease in the function if it's not excreting contrast. It will not be normal. Cannot be normal, okay? Any other uses for contrast medium in CT?
For activity, for example, in MS.
Yes, exactly. To detect a lesion activity. For example, in MS.
In EMS, in
Okay, if it is enhancing, it is active lesion. Not enhancing, not active lesion. Good job. There.
Sometimes
Recurrence and scar tissue can help us. So there are a lot of uses for IV contrast medium in radiology. زين يلا جماعة part 1. What are the physical properties of X-ray that make it the principle of designing CT scan? Can anyone help us here?
I have something I want to read it.
Okay.
The defining of the characteristic of X-rays, their ability to penetrate optically opaque materials, their wavelength of atomic dimension, the high energy of the individual X-ray photons,
We-
lead to a wide range of industrial,
It's
medical,
you're
scientific
absolutely
applications.
correct, but يعني we want to make it simple for someone in the medical school level, not at radiology postgraduate level. You are correct 100%. We need to explain it in simpler terms. The idea is that X-ray has high energy. It is capable of penetrating tissues at different rates according to the density of the tissue. يعني if the tissue is dense, X-ray will penetrate less. If the tissue is less dense, X-ray will penetrate more. يعني lungs contain air, X-ray penetrate very easily. While bone is dense, contains calcium, X-ray will not penetrate. So this difference in the penetration of different tissues, we can detect it by using X-ray film. The same idea is used in CT, just we add a computer. That's what's called computerized tomography, CT. Okay? Adding a computer, we can have hundreds of images of one plane, one cut, okay? And the computer will analyze it and reconstruct it and will show it to us as a CT image. Okay? It's a pretty basic question, but very important question. Why do we use X-ray in CT scan? Because it penetrates tissues to a different degrees. Okay? And we can detect how much is penetrated. Okay. I think one of the very interesting questions is the last one, which is why the bleeding in the abdomen will appear black. It's not black, it's hypodense, let's say. Meanwhile, it appears white color in brain CT scan.
Because brain,
Mhm.
skull is bone, dense tissue, and when the radiation penetrates it, it will obscure, and it will be.
The skull bone has absolutely nothing to do with it.
But I read it. This is not my.
Not skull? No, I don't think so. I don't agree on that. I don't know where someone will write it, but
Yes.
okay. What other opinions, let's say?
Stage of bleeding.
It depends on the stage of the bleeding. When you have intracranial hemorrhage, it is an acute, an emergency. So what appears dense on the X-ray is the RBC, the red blood cells. It's not any bleeding. The red blood cells that appear dense or white. While the serum, or the water, let's say, it's gray or hypodense, not black, it's gray, okay? So when there is bleeding in the brain, the CSF will maintain the RBC intact for a longer period of time, not forever, just little bit longer. The patient will be presented in the emergency department, will have CT scan done immediately, showing intact RBC as dense, white things in the brain, whatever, in the subdural, epidural, intraparenchymal, intraventricular. When they are RBC intact, they will appear white. Okay?
On the hemostry,
Acute stage, hemostry late stage,
yes.
chronic. In the acute stage, RBCs intact will appear as white.
Okay. This is
Okay?
What
Later, it will lyse and will start changing from dense to iso. Okay? This is in the brain. In the abdomen, what happens is that when there is a bleeding, there will be rapid separation of the RBC from the serum. So the RBC will deposit on whatever organ, and you will not be able to see it because they're just RBC in a big abdomen. What we will see is the serum as a fluid or its gray signal.
Dr. Why it's occur in the abdomen, this separation? Why not occur in the brain?
Because there is no CSF in the abdomen.
When there is
but there's other fluids.
Few cc's. The CSF is much more.
I know.
Okay.
Yes.
First of all. Second, usually we make CT scan in the abdomen, not in the acute stage, while we make it for the brain in the acute stage. So the stage of imaging is very critical for the diagnosis. If you make it in the very acute stage, you might see some density in the abdomen. You might. If it's large bleeding in a focal place, that the RBC is not separated from the serum, you might see.
In ultrasound.
Okay? The same idea.
If you see
She or he may mean ultrasound of abdomen.
Yes.
in acute stage,
Maybe. Maybe, okay.
Yes.
Ultrasound is another.
When there is
The
trauma
lateral.
patient, when there is hemorrhage, we see. I agree.
I totally agree. Okay. Thank you.